Hi there. I'm Liz Bancroft. I'm a clinical and counselling psychologist, IVF coach, trauma therapist, and somebody who's lived the IVF roller coaster from the inside out. If you're watching this, you're likely gearing up for or already deep in the IVF process and wondering if it's normal to feel so overwhelmed. Spoiler alert, it is. And here's the thing, nobody is shouting loud enough. Mental health care isn't optional during IVF. It's essential. So let's talk about why. IVF is not just a medical journey. It's a mental, emotional, and physical marathon wrapped in hope and injected with uncertainty. Look, you wouldn't run 42 kilometres without training your legs, so why go through IVF without prepping your mind? Here's the reality. 90% of women undergoing IVF experience symptoms of anxiety. 42% meet the clinical criteria for depression during treatment. And between 15 and 94% will meet the clinical criteria for PTSD. This isn't rare, it's the norm. So, let's talk about stress, not the just relax kind, the nervous system hijack kind. Stress messes with your sleep, your appetite, your memory, and yes, your reproductive hormones. Cortisol, the stress hormone, can impact estrogen levels, luteinizing hormone, and ovulation. So when I say mental health care is cycle care, I mean it. I support your nervous system so that your body can actually respond to the treatment you're investing so much into. Because here's usually what happens. Women wait until they're curled up in a post-clinic fog, crying in their car before they ask for help. One study found that 1 in 3 women drop out of IVF because of emotional burnout, not because of poor medical prognosis. So I want you to think about that. They didn't stop because it wouldn't work. They stopped because they couldn't keep coping. And that's what I'm trying to prevent. IVF can stir up more than most people expect. And for women with a history of trauma, medical anxiety, or neurodivergence, it's like pressing a button on an old bruise with a sledgehammer. Sensory overload in waiting rooms, confusing instructions, vulnerable procedures. And autistic individuals are more likely to have medical comorbidities and are under-supported in reproductive healthcare settings. And yet, most clinics don't adapt for neurodivergent needs, which is why trauma-informed, neuro-affirming support matters. IVF is just one decision after another. Which clinic, which protocol, how many embryos, what happens next? And when your brain is overwhelmed and emotionally flooded, you don't get clarity. You get more confusion followed by regret. And your executive functioning is directly impacted by chronic stress. So if you're struggling to decide or advocate for yourself, it's not because you're too emotional. It's because your brain is doing exactly what it's designed to when it's under threat. So mental health support helps you pause, regulate, and choose rather than react. And then here's the piece that nobody prepares you for, the 2-week wait, the test day, and then the aftershocks, whether it works or not. IVF is not just injections and scans. It's grief, hope, fear, isolation. And we know from research that psychological distress can persist long after IVF ends, especially for those without adequate support. Mental health is reproductive health. It deserves a seat at the table from day one. So if you're nodding along thinking, well, why didn't nobody tell me this sooner? That's why I created your roadmap through IVF. It's an evidence-based, trauma-informed support program designed to help you emotionally survive the IVF process, before you hit rock bottom, because surviving shouldn't be the goal. Thriving should. So click the link below to learn more and share this with someone who needs to hear it. Because you're not alone and you don't have to white knuckle your way through this.